Okay, are we live now? Okay, sorry. We have Corey Tello, Judy Buchanan,
Here,
Tina Heisner, Carla Pohl,
here.
Schaefer. So those are our Board of Health members, the Behavioral Health Policy and Funding Committee members. And then for the Mental Health Advisory Board joining us, we have Lori Walrath and Susan Campbell.
Mary.
Mary
Yeah.
Campbell. Mary Campbell. I'm
Mary.
sorry, Mary Campbell. I couldn't see the name.
Okay.
Mary, sorry.
It's okay.
We have
Okay, so we might as well get started. I know we have a slot scheduled from 3:30 to 5, and I would very much like to keep to the 5 o'clock end time, just because for staff and IT people who need to get home. So I had what we're here for today is for our committee, after having met jointly with the Mental Health Advisory Board, to develop a set of priority areas for funding for the mental health money that the Board of Health awards to the property tax. I thought that the meeting from the Mental Health Advisory Board was long and wonderful at the same time. We got a lot of, I think, good information, I think it provided people an opportunity for themselves to talk about what's going on with their programs. But I think it was hard to distill all that at the end of that meeting to anything that resembled some priority areas. So and Corey, please feel free to jump in. You did poll the group, and I know that we did not get feedback from everybody there or from the full Mental Health Advisory Board, but my notes indicate, and I think we came out with a recommendation that crisis services was an important area, psychiatric services, something I wrote down as mental health counseling, and then youth services. So I thought that as a starting point, I asked Amy, and my cat's joining us, is to take out the funding priorities from last year. And I asked if she could, and I don't know if you mastered that, to put it on a share screen for us, Amy, so we can look at it. And I thought as a starting point, we could work from the document. It's not certainly written in stone that that's what we do, but it seemed to me that these areas follow somewhat the same areas that we have identified in the past.
Hannah, that's
So,
the ones we had the same areas at the meeting on June 4th, other than domestic abuse had been added, but it was the exact same categories brought forward from last year that we had on that worksheet that the Mental Health Advisory Board had been provided. So there was no change in categories, just an addition.
Yeah, so I thought that we could take what we approved from the Board of Health last year, take a look at it, because I think there's some finer breakdown within that document as a starting point. Or I don't know if members of the committee at this point, do you want to, oops, looks like something's going on here.
I'm just getting to share.
Okay, great. All right, so but before we do that, certainly members of the group, I'd ask if you opportunity now to speak up in terms of how I view this process as first solidifying what our priority areas are. We will move from there into more specifics on programs within those areas, looking at both what we've done to date, what we need to focus on for the upcoming years, and even maybe start to talk about out years, because I think it's hard to change what we've been doing when we have historical relationships in the first year. So if we decide within the next 2 years out, we may want to shift some of that. I think it gives our partners a little more opportunity. But anybody want to speak up? Corey, I know you've had a lot of thought on this, and let me mention one more thing. Corey had also, and I think a great idea, had mentioned that there are a number of groups now who are doing various types of needs assessments. And we have existing ones from the CHIP program to our own mental health action plan. And I think Corey made an excellent suggestion that we gather those documents together. I'd like to have some way of parking it on the Board of Health website as either something available to the public, but certainly our committee to be able to use as reference guides. So I don't know, Corey, do you have anything you wanted to?
Well, I just wanted to say, and I know Lori made this point at our last meeting, and it was an excellent one, and that is that we want to make sure that we're getting current information. So some of the needs assessments have been done since the pandemic hit, and some have not. But I mean, I think if we put them all together, it will be very helpful. And I have learned about, so first of all, I think you all know, if you don't mind, I'm just going to mention them because I think it might let us know what type of information we can access. So United Way, as you know, is surveying 4,000 county students to find out their feelings about the climate and safety of their schools. So and I guess that's about to drop, I guess they have a university that's putting that together for them, and that's supposed to be available. And that has, my understanding is, I'm not sure exactly when that was given, but it's quite recent. Then I also learned that Mid-Central Community Action every year does a community needs assessment with their clients who are often, West Side. I think that there's kind of that region. Is that right, Mary? Is it more West Side or is it whole community? Is it more West Side? You think so? Okay. And so they had just finished one, and it's online at their website, and that was done in October of 19. And then you knew about the YWCA that just polled their clients, 362 of them, and that was done after the pandemic hit, and they were asked what their needs were now that they were in the middle of a pandemic, and then what they thought their needs would be afterwards. And then, of course, there's the Illinois Youth Survey, which polls 8th, 10th, and 12th graders in McLean County. And that is given every 2 years. So you have lots of longitudinal data that shows you the trends and whether our efforts are paying off or not. And that was done this year again. And it was done, I believe, in February of 20. But unfortunately, because of all issues, it was much smaller numbers this year than previously. And let's see, I think, and then of course we have the huge chip that we looked at. So I think those are the ones that I'm aware of, and it's, that's really good data. Yes.
Corey,
Judy, yes.
what's the status of the survey of gaps that Chestnut was going to be engaged in? Do we know anything about the status of that?
I have a call in to Joan Hartman to try to get that, and I was not able to get it. Does anybody in the room know? Check.
Yeah. So the last that I talked to them, when they attempted to do it, there wasn't enough people that completed it. And so the survey didn't have enough participants for it to be valid. And then when they were going to attempt to do it this spring, when I talked to Joan Hartman, she said that with like the pandemic and that happening and the nonprofits trying to figure out their next steps with the pandemic, that they didn't do it then either. So I'm not sure if they have plans on doing it in the future or if they've decided to not do it.
Thank you.
Yep.
Wasn't that supposed to be done, and Susan, just a sec, as part of the CHIP? When I reread the CHIP, I thought that survey was kind of a part of the mental health piece of the CHIP, but go ahead, Susan.
It was included in there, yes. They anticipated some results.
What did you say, Judy?
That there were some results anticipated, but it didn't say that they were going to do it, just that it was going to be happening.
Right. And the Chestnut survey, I think, was actually going through BHCC, and they were working with Tricia on that. And that's what I knew about that. But my question goes back to what Corey was saying, listing off some things. On the YWCA, you said that there were 362 clients that they And have they gotten any results, or is are those results posted somewhere that we can look at?
They are on, I can send them to you. I sent them to some of you, but not all of you. I will say that one of the things that's showing up on the Mid-Central Community Action Assessment and the YWCA assessment is that basic needs are through the roof. And so people are needing childcare. People are very stressed about childcare, and people are very stressed about being able to pay their rent, their mortgage payment, and their utilities. And I will tell you, I got a little bit of information. So if you remember, unemployment in McLean County went from April 2019, the unemployment claims were 364. In April of 20, are you ready? 4,923. And that was without putting in the March unemployment numbers of this year. So that is, and what people that are looking at needs right now is they are just hearing people be extraordinarily anxious and fearful about not being able to just do the basic needs of, they're afraid they're going to lose their house. They're afraid they're going to get kicked out. They can't pay rent. Mid-Central Community Action said they are getting 100 requests a day steadily now for help with mortgage payments, rent payment, utilities. We all know what United Way has been doing for food and how much money they have poured into the schools, and United Way together and other entities, how much they've poured into food support. And we know that's still going on. So, and then we heard from Megan Mosier. You know, I told you I had had a conversation with her about a month ago, I guess now, maybe 3 weeks ago. And she had shared again that and Path 2 has shared that they are getting more calls in April and May, and that those calls are about anxiety, depression, fear, hopelessness. And many of them do have to do with people being fearful that they can't meet monetary, some of their most severe depression is coming from people who have lost a job and do not see like that they are going to be able to get out of that situation anytime soon. And I think
interrupt, I'm sorry. And I think just, I think all that factors into what we need to do today, which is to take a look at these areas that we've identified in the past and see, are there some that by virtue of what we see as a major magnified need, do some of the areas that we thought were important in the past take a lesser priority now? And what kind of programming, and also being, I think, we're all very aware and need to be thinking about the populations that we're serving. So are we reaching a diverse group of people with these programs? And, so I guess unless anybody has any other comments, I'd say maybe Amy, you could put on the screen what we had before. And I guess I just want people to chime in, and Lori and Mary, please feel free just to join our conversation. I think we're pretty easy on public participation. So, happy to have your comments as we go along rather than wait and then try to add them back in. So I thought we'd go through these various areas that we've previously identified. Either we still think it's important enough, and then within the subtext of that, if there are things we need to be looking at. So Amy, you could put that up. You had it up before.
Okay. All right, so this is the highlights from the document from last year that was approved on the funding focus years or funding focus areas in calendar year 2020. And so Hannah asked that to just have this as a visual to be able to go through and highlight each funding focus area. And as Hannah said, just to talk about if we feel like this is a focus area that needs to move forward into 2021. And just the reminder that on deciding on which funding focus areas would move on to 21 is kind of at the higher level. And then there would be another meeting or another 2 meetings on specifics as far as the dynamics, the logistics of like what would fall into those focus areas. So today is just deciding about the specific funding focus areas that need approved by the Board of Health during their July meeting. So Hannah, would you like for me to start like the discussion as far as crisis hotline, or would you like to take over?
No, that's fine. You can go ahead and do that, Amy. I would just say that, you know, one of the things we don't know right now, something I think we need to think about is the dollars.
Yes.
This reflects, I think, about 1.7 million, if I'm right. Is that right, Amy?
1.3.
1.3
Yeah.
with the problem solved too? Okay. And that's what, and you know, obviously you can see the allocations, a large part of it is went to adult psych and the crisis. So, you know, that needs to be part of the discussion. I don't know. I think budget's just beginning to be worked on. We've always worked from a historical figure for this program. I don't know if anybody's feeling bold and wants to say, we got lots of people out there who are under a lot of stress, and we foresee a lot more need in the next upcoming year to either bring to the county board, the Board of Health, at least at this point, a suggestion that additional funds be allocated to this. Just something to throw out there. I certainly think it might be worth considering, particularly as we look at the programs beyond crisis and adult psych that may benefit from additional funding. So just something to think about. So Amy, I think we ought to start with, I guess, the big tickets and move down, just because, you know, that's where we've put most of our money. So
Anna, can I share one more thing about Bill, about what's going on with the funding for the agencies that I learned from talking to different agencies? And I'll try to be really brief. So as we had to move, as they all had to move to doing things remotely, first of all, it has, as you all know, it has created big issues with continued engagement with their clients. I mean, they've tried lots of things to make sure they could stay engaged, but obviously it's harder when you're not able to see your clients face to face. So that's an issue. The other issue is that you can imagine, as we think of the time we spent at the beginning of this meeting, getting everybody up to speed and getting everybody hooked to go. Okay, so people who are trying to do counseling online, they have that same issue because people in their homes, and think about some of these clients, they have technology that is not state of the art. They maybe have technology, but they don't have Wi-Fi. They may have both of those things, but they may not have the technology skills to troubleshoot when they disappear off the screen like we did earlier. So think about that, and then magnify that over time. Now, some of the agencies have even gone out and tried to help people learn how to get them hooked up at home, and even have let them use, borrow, they've given them equipment and stuff, but that still doesn't always mean that their Wi-Fi connection is going to work. It still doesn't always mean that they, like I said, they know how to troubleshoot. So it is a huge problem. So that's one issue, to just keep everybody connected. The other thing that is happening is they've gone to remote. It is harder for people tend to not stay in their sessions as long. So instead of having an hour face-to-face, they might have a shortened remote session because they're sitting at home and maybe the kids walk in or the dog jumps on them or whatever it might be. So they have shorter sessions. So they're billing for less time. The other thing that is true is for Medicaid. What happens is if you do not have a session that lasts at least 8 minutes, it's not billable. So in psychiatric, as they are trying to, when they sometimes just do quick contacts with their clients to say, is your medication working okay? They don't keep them on the line 8 minutes if they don't need to keep them on the line 8 minutes, because they want to move on to the next client so they can see everybody they need to talk to, everybody they need to talk to. So they can't bill for some of those things if they don't stay on. So that's been an issue. The other thing is the psychiatric, the psychiatrist has been working remotely, and while the nurses in psychiatric have not. They have continued to see people face to face. But then what happens is if they end up with a client that is with the nurse and they're maybe in that person's home, and that person has no technology, so they're using phone, and they're having to call the psychiatrist to get a medication change. The psychiatrist has to rely on the nurse to tell the nurse or to tell the psychiatrist what the nurse is seeing, because the psychiatrist, in order to make a med change, has to have an understanding of what that person looks like, not just what they're saying on the phone. So the nurse is important to be that observer for the psychiatrist. The problem is you can't bill for both of those people at the same time. Medicaid will not let you do that. So that's a problem with billing. They have to pick. If the nurse and the psychiatrist are working together, they can only bill for one of those services. So I just wanted to throw that out there because it's really been quite insane.
Thank you, Corey. And I think one of the things that I would just wrote a note down, which is impact of technology. And I think you've cited to some problems, but the other side of it may be, there may be a way of expanding services this way as well. I mean, I think a lot of life is changing now and accepting ways of doing things that we would never have thought of before. And I just happened to listen to a seminar for law talking about Zoom in the courts, and they were saying the attendance is better. So, let's not discount that there's a possible positive impact of this as well. So I think what your point is, we may need to think about either how we budget or what we budget for this if the costs are going up, or at least to start getting on board with it. But so why don't we go back and I guess the first question is there anybody who feels like we would not want to show, and just a category now, how we do it is different, adult psychiatry as a priority funding area? Okay, so we'd all agree that we still need to keep that. Now within that, obviously the method that we've used is to fund an agency, and a single agency, although we did try to open it up last year and that proved to be problematic. One of the areas I think we should look at going forward is, everybody says we have lax psychiatrists in this community. I think, Mary, you made a really good point on that when the Mental Health Advisory Board met. And people have known this. We tried to tease it out every which way we can, and we still come back. So maybe our thought should be, how do we maximize the resources that we have? And I don't know whether that by going to a fee-for-service, a voucher system. I mean, there's lots of different things we could think of doing that might get that resource to more people, because it seems like we have a problem with how much we use it. Maybe they're maxed out. I don't know, but any thoughts on?
One thing I think about when I try to think about this, the whole psychiatric adult services is, they've got a department at CHS that has been working on that for years. And again, I'm not pushing this. I'm just laying this out because whoever does it has to have a well-honed system for working with those clients. I mean, they have to know how to, because there's a lot of education. There's a lot of case management. There's a lot of, like they explained that they've been spending a lot of time working with these people to help them understand all the precautions they need to take because of the pandemic, because some of them just don't think like that. So they've spent much more time educating them about, just safety. So I guess what I'm saying is we just need to make sure we have a team of people who are delivering that psychiatric service that clearly understand the clientele, clearly have all the skills they need to be both case managers, educators, consultants, advocates, and work with that work with the company where they get the low cost meds or free meds. So we just have to make sure that we understand we really need a whole team and a system as we look at adult psychiatry.
Well, last year we allocated $400,000 of our funds for that. Any thoughts on, was it remain the suggested amount? Judy, I see you've got you're on, or did you want to have something to say, or?
Yeah, I do. I'm looking at this list, and I'm assuming that when you mentioned we would start with discussing adult psychiatry, is this in any priority order? Because for me, particularly as I read some of the materials that Corey made available and other documents in terms of what some of the needs are, the crisis hotline to me appears to be a major center of the wheel here that has to go around and take care of people. They at this point apparently are trying to do a great deal more with many more requests for their assistance with not a lot of revenue coming in, a lot of volunteers. I really think we need to look seriously at that particular service and how they are doing their job, how we could be of greater help, and also in educating our community that is available, because that appears to be the conduit that channels people to all these other services we're talking about.
Can I just throw into, I'm so sorry, but I have been gathering lots of information, so tell me to shut up. But I just want you all also to know, United Way is partnering with some other agencies, including PATH, to do the 211 campaign, 211 campaign, so that they really get the word out to use that. And then they've also, United Way with other agencies has also spearheaded the Housing Coalition. And so I believe that some of those, does anybody know, Mary, you might know, does that Housing Coalition, does that go through PATH as well, or does that have a different entry number and point?
I'm not sure. I know that has been a big focus of the United Way conversation. It's, yeah, as we look forward, and no one really knows at what point the people will be evicted. So that's a big fear as to, will it be the 31st of the next month? Will it be postponed? So they're really trying to have resources available and legal resources available as well to protect those individuals. The only other thing I wanted to add was, Corey, I had my mic off. Mid-Central Community Action Survey, they actually, it isn't just the West Side. They serve the whole county, and they bring a lot of people in from the rural McLean County. So I just wanted to add that was also part of that survey population, and that probably the YWCA's responses were, the biggest service that they've been able to maintain was for essential childcare. And so a lot of the reason that you hear that panic about childcare is maybe partly related to who they were able to survey. That's all.
Susan, I saw you waving your hand. Did you have something? No? Okay. And Judy, in answer to your question, I see Judy and Lori. I wasn't trying to prioritize at this point. I just picked that because it's the largest amount of money. And obviously, as we go through this, we are looking at committing or saying we want to commit a certain amount to certain programs, which then affect the others. So, if that makes sense.
It does, and thank you. And I think just some food for thought as we go forward with what we are hearing in this conversation, and with those who have talked with the PATH director, Karen Zangerly, it appears that the 211 will hopefully be that tool that will allow these people who are experiencing the anxiety and the fearlessness of, I'm being led to believe that maybe enough people don't know about PATH. And right now we need to be sure that people know that they can call someone and be directed. And then that begs another point, and that is the fact that the PATH volunteers and the operation may not be as familiar with what is going on and what is available in our community. And I don't think that the fear and anxiety that we're experiencing now, I think we're going to have this with us for at least a year, if not longer. So to me, again, that crisis and that 211 is for me a top priority. I think everything else feeds to that.
Laura, you had your hand up, and then Susan.
I was just trying to think of some process for this. Wondered if anybody's heard directly from an agency that how much that they might come and they need more or in a specific area. And if not, whether when in your question about asking for more money, if we couldn't, you couldn't, your board couldn't ask for a pot of money to be, which who knows where that'll come from, but would be out there so that we could respond with special grants, perhaps, you know, when people need laptops to give to people or whatever, you know, whatever comes up, because I don't know that it doesn't sound, I mean, I don't, but maybe some of you do know of some specific need where we would channel any increase in funding.
Yeah, I understand. So Susan, go ahead.
Yeah, I thought that we're going to just look at the funding areas, the focus funding areas today, and determine that, you know, which ones we really going to do. But when it comes to the amount of dollars that we want to sit there and talk about, if we're going to look at different possible things like fee for service or vouchers and things like that, I think that might need a little bit more research before we sit there and to say we want to spend X number of dollars on whatever program this is, you know, kind of thing. What would a voucher buy, you know, kind of thing. Yeah. And can we get more people, less people, you know, for those dollars? And so I think that maybe we want to just focus on the areas, and then we know what we've historically spent in the past, and we can't sit there and add 3 or 4 more programs at, you know, $100,000 a piece, you know, kind of thing. But to actually say a dollar amount, I would kind of be cautious there. And
yeah, no, that's a good point. And that's fine. If we want to just go forward at this point with just, let's talk about the areas. We have our list here. Judy, certainly heard you loud and clear. I concur with you that crisis response hotline is specifically listed there. But wait a minute. So where's the other? Oh, then the mobile crisis.
And I don't know whether this, as we look at the focus areas, and I agree with Susan, that's where we need to start. I, for one, would be supportive of our preparing a proposal for the county board. I know dollars are going to be limited and stretched farther than they ever have been. But if we look as a public health department at social determinants, we do know, and we have that history and that documentation and that evidence that the social determinants contribute so much to people's healthiness. And I believe we could build a case for the fact that right now that the social determinant of COVID and what it's doing certainly is contributing to inequities and a case for reduced health status. So, and Susan, I can see you almost going, oh yeah, sure. I think that we, as responsible stewards, need to step up and say that this is probably a place where we need to really ask for some additional dollars. So I'm just putting that out there.
Yeah, and just, I mean, I think it's hard to do this without a discussion of dollars because, you know, they're kind of hand in glove in a sense, but I think at least maybe today we can say, are there any of these areas, either new areas of concern that we should add to this list, and are there areas that have, I mean, there's nothing that isn't important on a list of this sort. It's just a question of whether we feel, given the circumstances, that some could be, you know, pushed aside for this year, or, you know, what we need to do. So, and I agree, Judy, I think we need to come to that and say, you know, perhaps, you know, after we agree on some funding priorities, I think then we need to look at, you know, how we handle the funds. And you're right, Susan, how do you determine, do you change the way you do this, and then do you need less money, more money, and some of the technology may affect that. So yes, Ms. Schaefer, please.
I think you want to make sure you look at the CAFR before you go to the county board, because I think that there's some things that you might see in there that might be enlightening. And so because I've glanced at it pretty quickly, but I think that that's something that we need to look at before we ever go any other direction on that. And so my question now is, okay, we've already decided on adult psychiatry and crisis hotline.
Mhm.
I'm going to throw out something to see what we think about that. And on the promoting positive child-parental relationships, is that something that could possibly be kind of not done for a year maybe because of maybe needing the funds for somewhere else? I mean, I understand that we want to do prevention and early intervention. I get that part of it. But is that something that could be, for a year maybe? I know Corey's on the Baby Fold board, and I don't know if there's a conflict of interest here, if she talks about it or not. But to me, in a way, do we need some other services for a year? And I think that's what you were asking earlier, Hannah, about, is there something that we should or we shouldn't do, kind of thing?
Right. I was thinking, yes, at this point, that's exactly what I was asking for some input on. So thoughts on what Susan's suggesting. Lori?
I think just go in a slightly different direction, and maybe that's what Susan was referring to a little bit earlier, but if we put out some very broad categories for organizations to respond to, and ask them in part to say, and hopefully they would be responding to what's currently needed in the community, and without putting out a dollar amount for them, they have to package it in some sorts of like, we can do X per person for this amount in these areas, and somehow, so that we're not saying, oh, here, dangle $400,000 in front of somebody and let them try to fill that $400,000. We say, what can you provide for us? And name your price, and then we can go back, or you can go back and say, when everything is in, well, here were our priorities. Here's how much money it looks like we're going to have, and we'll fund this chunk or that chunk in these different ways, rather than saying out front, here, Phil, tell us how you're going to spend $382,000. You understand what I'm saying there?
Yes, and I think one of the difficulties we have is that we have a history, and I agree that, so when you have certain organizations, it'll be not surprising to see that they would suggest they need just about what we've been giving them in the past. So I don't know the best. I agree. You say, here's 400,000, anybody would figure out a way to spend it. I would. Mm-hmm. But if you say, we've got X amount of money, here's this program we want, make an offer, kind of.
Well, it's a problem too, that we don't know how much money we really are going to have, and I'll let Susan comment. As a county board member, I'm not sure we know what we're going to be able to spend on anything this year.
Yeah, that's another issue. So why don't we kind of let's move off of maybe the dollars. I think, that we've got to get some advice from other people about how best to do this. I know that, I bet you Camille has some good history of dealing with grants making, and, see how, and, maybe other folks who've done more grant applications have seen it go both ways. So, I think as a group, we're concurring that the adult psych, and I would just say crisis response rather than specifically say crisis hotline or crisis unit. I think we feel that crisis response is important still. Is that fair to put those two together? So we have crisis hotline and mobile crisis unit as two separate priorities, but it's really crisis response. Okay. So I think,
can I throw in, go ahead.
go ahead, Mary.
Okay, I was just gonna say, I really, I mean, I don't have any history with this group, but we're in like uncharted territory right now. And I really like the idea that Lori put out there is to ask the organizations to be a little bit more creative and approach us with a way to address what they're seeing currently in their agency that falls under a number of categories. And when I look at this list, you know, there are categories that can be lumped together. And then maybe out of that, but I don't want them just to make things up, obviously. So it has to be really grounded in good research and previous programs that have been found to be effective in circumstances like a trauma-informed or a crisis situation. I mean, I would want it to be a really good proposal, and I think we would have to tease that out, whoever gets to be the lucky person to do that. But it's almost like we don't, everything you read, it says that, you know, the level of stress and crisis is incredible on the part of families right now. And so, you know, is it adult psychiatry that will be the greatest need, or is it positive relationships at home between the adult parent and the kids? I don't know. Certainly, crisis is an important component in how that's addressed. Maybe out of it, they will get together, two organizations will get together and propose a joint proposal that might address it at a less costly way. So I kind of like that idea, Lori, asking for us to kind of, instead of saying, I think that's true. If you say there's 400,000, I'm going to write a proposal that's going to be like 397. That's just kind of the way it works. So maybe we want to see what they have to offer in terms of creative interventions.
Yeah, and I see your hand up, Corey. And Carla, have you been waiting to say anything? You've got your green light on.
I just had a couple of questions to ask about.
Okay.
So this money is from the taxes that's allocated to behavioral health, right?
Yes.
Okay, so that it can only be used on behavioral health categories, is that correct?
Yes, it's a levy specifically for mental health.
Okay. And does the county have any restrictions on how you can do an RFP? I mean,
Well, I think we, no, I mean, I think we've battled, and I think I saw Corey, your hand up, and I may be saying what you're thinking, but, you know, I think the last few years we've tried to make this a more structured process. It was pretty unstructured for a number of years, and trying to formalize it. And no, the county doesn't have a few things, whether we call it a procurement policy that I'm aware of that specifically
Okay.
states issue an RFP. Is that what your question is?
Yeah, so we could do what Lori's suggesting. I guess that's where I was going. Is it possible for us to even do that?
Well, that's what Amy did last year. It was RFPs that they responded to. And what we threw out there was basically the outcomes and objectives we were hoping to get. And then, and we framed that, and then they responded whether they wanted to go for that or not, whether they wanted to try to meet those outcomes and objectives and decide they wanted to sign on for that. But,
Right, but that's a real directive. That's way more directive than what folks are talking about now.
right.
Yeah.
And that's what I wanted to say. I could see, like, I'm kind of thinking, we've always really promoted collaboration, but I feel like because of everything I'm finding out, like everybody's doing something, you know, United Way is doing some stuff. I mean, there's so many, the State Board of Education is putting 52 I think it's 54.2 million towards trying to help families get technology they need. So, I mean, there's all these things happening that and again, and so I think we need to try to get agencies to work together because sometimes they're already doing things that are moving in that direction. And so we need to put them together and say, what can you do together? And it might even be blended with some funding they already are getting with some of our funding and come up with, services for youth. And Project Oz would be very able to tell us, for example, is the youth suicide issue becoming bigger? And do we still need to make sure that we're doing all that education around youth suicide all around the county versus something else they are seeing the need for? So again, I just think we need to get agencies, as Lori suggested, but I think we need to get them to come up with collaborative plans of how they might meet the needs of youth. Because I was even thinking, okay, so we've been talking about school resource officers. So there's a pot of money that goes into school resource officers, and that's already going to be discussed a little bit. And I'm not saying I'm for them or against them. I'm just saying, if there's a way to even use those school resource officers in a slightly different way so that more benefit can be given, like almost like a community schools idea where, they're doing more to reach into the neighborhood. So it's kind of like community policing with the school resource officers, but they're making connections with the most at-risk families or something. I mean, I just could see, getting like all of the players that work in schools to come
Let me ask you-
together and say, how could we build something? But here, I want to say, go ahead.
I'm just saying, with regard to that and the collaboration piece, and somehow I'm losing people's pictures here. I don't know if you guys are too. We've talked about engaging the Regional Office of Education. For example, the Embedded Schools project that we've had has been basically put out there for counseling services to put in proposals for, and then tell us which schools they're going to. We've talked about whether it makes more sense to have that start from the other side, looking at schools, starting with somebody who has a better picture of what schools need these resources and sort of be a clearinghouse or a conduit for that. So we may be looking at something which, instead of these separate funds to different agencies to go into the school, something that's more like the problem-solving court model, where you have a centralized organization that's then figuring out where the money can best be used within the school
Well,
system.
I just think because they just all need to talk together about what is the pot of services that schools are going to most need, and how can we collectively deliver those. I just think it's time to really make it be this is an all hands on deck time. It's don't worry about, just what's my piece. Let's talk about what does the composite need to look like so youth get their needs met. And I'm not even saying it has to be delivered in schools. I'm just saying, what are the youth needs right now, and how can collectively all the agencies, and including school resource officers. I mean, that's a whole nother thing we've never talked about. I mean, what is there other pots that we should be drawing in? But let me say one other thing that scares me about doing that this year. I will tell you, in talking to agency people, and some of you know this, those people are so fried right now. They are fried because they have had to change their entire way of doing work. They have been struggling to keep their clients engaged. They have been having to learn new ways to do their work. They are exhausted. And they, and in some cases, like Project Oz had to rewrite their curriculum to get it delivered remotely. I mean, it has just been scramble. And so this is going to be a year. And also in some of the agencies, they've furloughed people. Chestnut's furloughing people that we use. So this is going to be a hard time to say, gee, we want you to do a wonderful brand new brainstorm. So we also have to think about that. What are they capable of right now, given that they also have been through a pandemic and a social injustice issue, and they're exhausted. So just point.
All right. Thanks, Corey. Let Susan, you got your hand up.
Yeah, I'd just like to reinforce what you said about Regional Office of Education, because I believe, if I read correctly, that schools are also going to be getting money specifically for mental health services from the CARES Act that was, you know, the federal dollars that are being passed through the state. And there was a talk, and not talk, it had dollar amounts or whatever. And I think that we need to go through and with ROE and talk to Mark to find out what the schools are getting and what they're going to be doing with that money, and how are they going to address that? Because is that something that we're already doing, and we're getting, you know, the schools are then getting federal money to do that, then we can take the money that we're using and do it something else with it. So I think that we really kind of need to research that too, on the embedded schools and the youth, you know, stuff that all Corey was talking about. But I really do think we need to see what the schools are going to get already, because I know that there's money being funneled to them.
I have a call in to Mark Jontry. I really hope to talk with him before this meeting, and we just didn't get to touch base. But I mean, it doesn't have to be me, but yes, we definitely need to find out from Mark what pot is coming their way, if any. But I also want to add that the state did take some of the money that some of the agencies got for their protecting personnel. Remember that pot of money that you could get, the grants you could get if you promise not to lay off your staff. And so some of the social service agencies went for that. And so they got the money in a very timely fashion. It was good. But then my understanding is that there is that the state is now trying to take some of that money back, about a third of it back. So just another issue.
So let me, I see that we're at about 4:30 here. And, you know, as is often the case when we start talking about this, it's just like, how do we fix this? So, and I know that we have gone back and forth between the idea of saying, just send us proposals for how you think best you can address the needs and be creative, and, you know, versus having some category of services. And I feel we're a little bit in a, you know, I think we've identified already, which is literally 2/3 of our money, which was crisis services and psych services. And I don't know that as we talk about these other kind of creative programming, I mean, one thought I have is to say we're probably going to stick with those two big subject areas and with the kind of funding. And that, I think, Susan, your question about does a positive child-parental relationships, maybe it's a preventive program. It's aimed at early childhood. We've got things that are up the chain for that. Of course, it's a good program, but is it something that we need to think about diverting some resources to the more immediate crisis needs that we know we're going to face over the next year?
I'm just wondering if we shouldn't just put this umbrella, just like we kind of, like Hannah, you suggested putting the two crisis kind of into crisis. I'm wondering if some of these things that serve youth, we should just call it a youth category and then work with the agencies to help us define what should be under that. And so rather than saying we're taking something completely off the table, I'm thinking, and I think Mary mentioned it earlier, I'm saying we collapse some of these into a larger category. And then before we put RFPs out, we have meaningful conversations, get input from the agencies collectively in a meeting that maybe we call, that says, okay, so we got money for youth. Talk to us about what do you see you need? What's going on in prevention? What's going on in schools? What's going on in communities? What's going on, you know, with families? And then what together could we build that would serve youth best right now? So I'm suggesting.
Yeah, I mean, I think in the categories, we just call that youth services, and we take the suicide prevention, substance use, maybe we call it school or out of school, or
what we could do: embedded schools, promote positive child-parent relationships, youth substance use, suicide, put them all together and say youth and then figure out, and then meet with agencies and say, tell us how we build this for the urgency right now and beyond.
So, and Brett, we
I
just,
would just add, I
I'm
was going to
sorry.
say, you can add into your explanation to them that the priorities are given when collaboration is created within different organizations, and that becomes an impetus for them to begin to have more conversations with comparable agencies, and it usually works.
Mhm. So in that case, we'd have crisis response, adult psychiatry, abroad youth services, youth mental health, behavioral health services. And then that just leaves the problem solving courts as a separate category. Thoughts on problem solving courts?
Hey, let me be the one that says it. Is that our most urgent need right now?
Well, I do know one thing that I heard, and I know it's been a problem, and I don't know that the problem solving courts address it, is that continuity of care when people leave the our jail or come out of the correctional system and need to be followed up with psychiatric or counseling services. I think there's a need out there, at least I heard that. So I don't know whether the problem solving courts, I don't believe that's their focus, because once you graduate, I don't know that there's anything out there for you. And of course, until you do, you've got a lot of intensive services available. And again, they focus on the less serious, that's not the right way to say it, but rather than having the people with the extreme drug problems, they don't typically.
Yeah, this problem
I
solving.
don't know what our client base looks like in there. I've been wanting to look that up.
The
I'm sorry.
problem solving
Susan,
courts,
would you
One of
say
the ways-
something?
the people coming out of jail, that's, and that continuity of thing, that's not problem solving courts.
No, but I think it's a great, and we had sort of an ad hoc system for dealing with it some years ago. I don't think that's been going on, has it, Amy? The meetings
So
with
real quick with the-
DHS.
Sorry.
Mary, what do you know about that? Mary, you probably have the closest connection to that group.
There are a couple of programs in town now that are small not-for-profits, like Labyrinth. There's also one for men, and they are trying to work on the outside to help make a transition for people when they leave the jail. But as somebody pointed out, the problem-solving courts are distinctly different, and even though when they have finished their services, there may not be a ton of follow-up, they have been embedded in a lot of the agencies and services during the time when they're in the problem-solving court system. So that actually is a way to keep our county jail amounts down. That actually keeps people out of the jail by addressing their mental health and their substance abuse issues while they are still in the community. But I don't think that I've not ever heard that there's anything from within the jail that helps make a transition for a person who leaves the jail from the jail's point of view, from the inside of the system. I think when you're released, and that's pretty much it. That's true also of prison.
So can I
And,
quickly comment, please? Can I
Well,
comment?
Go ahead, Amy.
Okay, so there's some of the comments are a little inaccurate. So as far as with referral resources from the jail or from IDOC, it oftentimes depends on what program that individual may be in during their time. And so there are people that are in the McLean County Jail that have some of the counselors that work specifically for the jail that will provide very specific referrals to them to go to a certain agency on a certain date and time. And the same thing with IDOC, depending on what program that individual is in, they may also have that referral given to them prior to them leaving, but that's not how all of them are. So some of them will just leave without those connections. And then as far as Labyrinth House has programming, some like support groups that they do that like maybe that a certain amount of individuals can attend. But as far as Labyrinth House, only 8 women are able to live within that setting. And oftentimes there's a long waiting list. And so they try to keep engaged with them as long as they can. But those are also women coming out of IDOC, or they've been out of IDOC. So it's not just women coming out of McLean County Jail. And then some of the women coming out of the jail system, again, like they may not directly, most of the times they're not going to directly go from jail to Labyrinth House because there's such a long wait list, because there's so few women that can be in that program. And then lastly, as far as problem solving courts, that program supports recovery court and drug court. And so it's about, I can't remember how many are in it. I think around 60 between drug court and recovery court. And how you get into that program is they do have to be very high significant risk. And so drug use or their mental health, depending on which problem-solving court they would be in, they do not take low-risk offenders. They have to be very high risk, because during that program, the services that they receive are very intense, and it's shown to not be effective for people that are low risk to have such intense services. But as far as what the Board of Health is paying for problem-solving courts is the majority of that money goes to Chestnut to provide recovery coaches for individuals that are in the drug court. And so the recovery coaches are non-billable individuals, are non-billable services provided. And so that's where a lot of that money goes to, is the recovery coaches, and then the individuals from Chestnut to be able to attend staffing. And so they do have staffing every week of each individual that would be in drug court. And then a very small amount of that problem-solving course, like $8,000, goes to Center for Human Services to be able to provide staffing for their individuals that are in recovery court. And then about $25,000 of it goes to CYFS, Center for Youth and Family Solutions, about $25,000 for the MRT group. Moral recognition group, or moral recognition therapy, that's specific to the offender population. So hopefully that answered all of those questions that you guys had in the last couple of minutes.
Yeah, and so, but how about, what does the group think about, rather than, again, being specifically, so our criminal justice dollars are going to the problem-solving courts. Maybe we should call that category criminal justice.
I love that idea. We have not rethought that in years. And again, this may not be the year to be doing that, but it would be good, I think, to look at that with fresh eyes.
Yeah, I mean, it just broadens the category away from a specific area. And, these are coming out now, and I know that there will be lots of discussion about this. So, but I think I like the idea that we've come up with of sort of collapsing these into more general types of categories to, see who can be creative. And maybe, as you said, Corey, they're so tired that nobody has the energy to do that this year. But it may come from us more then as we do this. So to kind of recap, I think right now what we're talking about, and we have not rank ordered these, is our funding focus areas would be for adult psychiatry, crisis response, youth, and I don't know, I see you, Judy, hang on, and I'll get to you. I don't know if youth are, whether there's an age. Our psychiatry starts at 12, so I guess youth would be 12 and under services.
Oh no, we have to go up to 21 for kids with disabilities. I mean, it would be at least 18 and then up to 21 with kids with disabilities. Yeah.
And then And that would that would collapse youth substance use, suicide, embedded schools, positive child parent relationships. And then a fourth category would be criminal justice. Judy.
Where in the mix here do we have counseling services for either youth or adults? We have adult psychiatry, which, and I understand that in the whole medications component, but I think we're also learning that people just need a counselor, someone to help them work through this anxiety. And it may or may not be necessary to have medication. So where in the list are we saying would be counseling?
Well, do you want to make adult psychiatry / counseling or adult mental health? I mean, we've taken a group youth and just called it youth mental health. Do we want to say adult? And then, I mean, I agree with you. We don't have dollars that we currently, I think, allocate for just counseling services.
I would like that. I like that a lot, Hannah. I find it troublesome that the biggest chunk of our money is just going to psychiatry. I think that's a very small portion of what the needs are of the population that's served. So I would be encouraged to expand it and to adult mental health services or something. And then let psychiatry be one component of it. Obviously, they need medication, but there are mental health nurse practitioners, and certainly there are psychiatrists, but they also need the counseling component. They won't keep taking their medication if all they do is come in and get their pills. They need that sort of wraparound services for the mental health. So I would like to expand it. I didn't particularly like just that particular category by name.
Well, and I agree, Mary, because I think adult services, because psychiatry is a much different type of service than sitting down with a counselor. And they do go together, but they are both very different. So
Yeah, and I just want to say, like I said before, you're buying a whole team when you're buying psychiatry, though. You're buying a team because you're getting the nurse practitioners and the doctors, and you're getting case management as well as meds and all of that. But I'm fine with the idea of counseling, but just remember that what we have typically paid for in counseling is we have typically paid for the gaps. So like for services that are not billable, we have paid for those that, we fill in those gaps where they can't bill for something. And so I think we need to really think about, that's another thing where we have to go back to our partners, our provider partners, and say, what parts are you unable to pay for right now related to counseling? Because we have never paid, like even in embedded schools, we aren't really paying for counseling. We're paying them to do counseling, but we're paying for like the people that aren't covered under insurance, if that makes sense.
I was going to say that, in fact, I was thinking that, CHS, for example, is able to bill for counseling services. But I think as I look at the list, in particular, what I'm hearing from the public and others, that just counseling and getting that level of support. So I think the omission of that would be a loss and something that we should be definitely taking a look at, because yes, and there are gaps. CHS and everyone may say we don't need your dollars, these tax dollars. We can do it. We have other sources. But until we know that for sure, since I think that is a great need, I believe we should include it.
Well, and just let me say, along the same lines as you were referring to, Corey, we are very I would not say inconsistent. I'm not going to say that, but I think we have often called ourselves funds of last resort or not to supplant other funding sources. But I think if you look across the programs we fund, we're not consistently doing that. So, certainly, I think we provide more of a capacity grant for the psychiatric services. And we've not really come to terms with whether we still want to continue that, whether that has to happen to ensure that those services are there. That's the point of a capacity grant. And one of the things I think another issue for the upcoming year is the number of people unemployed means a number of people have lost their health insurance. So there's probably going to be more people who cannot afford to pay for the services. So
That gap, the gap went from this to this.
yeah,
So
tremendous. And I think the exchanges, I think they might have been opened up. I'm not sure, but I think there's going to be far more people out there without health insurance. So I think that we need to really think about that as we look at how our dollars are used to ensure that people who can't pay for these services have access to them through our funds. So I guess we could either call adult psychiatry / counseling or just adult mental health, which seems sort of like what this is all about. But I think, as sort of general categories of services, what do people think about taking away the psychiatry and just calling it more broadly mental health?
And I would be in agreement with that. And if we want to keep the word psychiatry, I think we have to include a separate category of counseling, because to say psychiatry / counseling would imply that they, they're one and the same. And when in fact, I think most of us recognize that while they do case management, it's generally around the medication and whether people are taking it and the impact it's having. It is very little of what I think of as a counseling session.
Okay. So anybody want to make a motion to approve what I think we have 4 areas for funding focus or priorities?
Would you review those 4 areas for us, Hannah?
Okay, at this point, I believe what we have concurred on is that there be crisis response, youth services, criminal justice, and these are not, maybe we can have a motion to approve them and then we can kind of give them better names, but, and then adult mental health or behavioral health services.
Mm-hmm.
Those are the 4, I think that,
I'll make that motion.
okay.
Second. It's a good one.
Okay, second. So what we'll do then is we will take these. Now we do have a meeting, our kind of regular scheduled meeting was July 6th. Is that right, Amy?
I'm sorry, can you guys, we missed who motioned to move that, and who said it?
Susan Schaefer made the motion and Judy seconded it. Sorry.
Thank you guys for that. Yeah, so can we were going to discuss with the group if July 6th would be appropriate to meet to discuss some of the logistics of these categories. We're meeting the beginning of August to discuss some of the specifics of the categories, because the goal is for the RFPs to go out August 10th, or the middle of August is the goal for the RFPs to go out. So that would give us 2 goals, or if we met July 6th and the Monday in August, the first Monday in August, that would give us 2 meetings to have all the logistics out there for me to be able to write the RFPs and have them distributed the middle of August. Because if we meet July 6th, we wouldn't meet again until a week before the RFPs are supposed to go out.
I would definitely concur, because I think at this point, we know that our board is going to ask us for an explanation of what do we mean by these 4 categories, what might be included, what's our thinking. And I would like us come together on the 6th prior to our board meeting and have that conversation so that we're all agreed as to what we think each category does represent in services.
Yes, Corey?
yeah, can I also say, remember that what we do impacts, remember that all the agencies are trying to set a budget right now too. And they're freaking out because they have again, their bottom line has been decimated and they don't know, everything is very uncertain even on what their services are going to look like going into the next year, how much remote, how much person to person. So my point is, we have to be mindful that our budget decisions, if have a huge impact on their budget decisions. Because like Project Oz, if we give them $120,000 and we pull that out, that's huge. And it means they'll be laying off staff. So, I mean, I'm not even sure what I'm saying other than we have to be mindful of the huge impact some of these dollars have on some of these agencies. So, which is why I think as far as voting on accepting these, I think it's great, but I think we should say it's with the caveat that we quickly start meeting with these agencies so they know what we're thinking and they can start factoring that into their, short and long-term plans. I think we owe them that sooner rather than later. We need to get them together and help them understand what we're thinking.
And if I might, and to that point, that's
Okay,
another
yeah, so I
reason
guess we,
our meeting on the 6th is very important, because I believe, our mission and our focus should be on the areas that need service. I certainly do understand the agencies need to have some idea, but if we pose this in such a way, particularly during these times, that we're looking at the services our people in this community are telling us that they need to have, and that's really driving this. Hopefully they will understand and be able to work with us.
well, and I think that's why we've taken the approach of just having broader categories for now. I think we do have a motion on the floor that we haven't voted on. So all those in favor of the 4 categories that we've, and Mary and Lori, you don't vote, sorry. So.
Oh, okay.
on the
Can I
committee,
say
if
a
you can vote-
comment before you vote?
Sure.
Yeah, can I say a comment before you vote? I find the category called criminal justice unacceptable. I don't think it reflects what it is you are intending. I couldn't come up with a better name at the moment. But I mean, supportive services for, problem solving in the courts was actually a really good title, but there's probably a better piece of language I would encourage you to find, because criminal justice has a whole different connotation, and I'm not sure you want that.
Especially
And because I
now.
don't.
Especially now.
Can we do, I have a suggestion. Can we do justice involved behavioral health services or criminal justice behavioral health services? So I
What
don't
was
think
the first one, Amy?
criminal justice. So either
And
just,
Maybe we should just go back to problem solving courts, because that's the way it's, it's solving a problem.
so I was thinking I was thinking that with it being a broader category, I was thinking about some of the mental health advisory board discussion, that if it was a broader category, maybe there would be other providers, other programs that would come to the table to say, okay, like if someone's coming out of the jail or the detention center, how can we connect them to, we will take or connect them to psychiatry, we will connect them to these services, we will provide certain services. So if it was broader, it would be more than just problem solving course that could apply for it. But maybe I misunderstood.
And let me just say too, Susan, I think problem solving courts is very specific to that program. So, but I think we have the triage center right now. We have the FUSE program. We have programs that are focusing on getting people not to enter the criminal justice system due to mental health issues. I think our thoughts were either successful movement out of the criminal justice system or continuum of care following incarceration. I mean, that's what I was thinking when we talked about criminal justice. One thought I may have is if I agree, I think criminal justice is too broad. But I think that's where I was going, was not so much at the front end, but at the release end, focusing on what programs would target people who have been in the criminal justice system, who need help transitioning and continuing their care once they are released. So, and I agree, it's hard sometimes to come up with something on the fly. We could, Agreed.
Support for justice involved adults, because isn't it going to be only adults? Because we don't dip into youth on this, correct?
Well,
None of the problem solving courts do.
you,
So something about,
Behavioral health services to support justice involved individuals.
but should we say adults so nobody gets confused that we're talking about juvenile probation or anything like that? We're not,
Yeah.
we don't want anybody to go there right now.
Behavioral health services to support justice involved adults.
that, that works. How do people think about that? Mary, does that come closer to what you were thinking, Mary?
That's like so broad. I don't know. I think what I hear you all saying is you want to continue to support the problem-solving court model of keeping people out of the jail and helping address their mental health and their substance issues, which got them into trouble in the first place. But I also am hearing you want to have something available, which of course should have been there a long time ago, for the people who are released, to keep them, get them the services that some sort of a link between the jail or the prison and the community, someone doing that so that they actually get on their medication that they were getting when they were in jail, or getting the or even getting a state ID, those kinds of things. So am I hearing that then? It's both. So we need a category, but not quite as broad as Amy's.
What about this? What about this? Yeah, this is
What
my
about-
last try.
Yeah. Is that, that we approve this motion with the understanding that there'll be some brainstorming, and prior to the board meeting, we'll come up with something that better characterizes that focus area. And we can, by email, just share it. Does that work for people?
Yes, and could I also do another caveat to the motion, and that is that like determine, I don't know what I'm even, we need to involve the agencies to, we need input from the agencies to be able to drill down into this. And I don't know if I think we need to add that to the motion. Oh my gosh, how cute. Oh my
But
God.
do we need that for the motion for the focus areas, or just the, no? Okay. Just
No,
the,
no, okay.
okay.
Because
Oh my
we
gosh.
fund, like what Judy said, we fund services, we don't fund agencies. And so, we might be concerned about agencies and their financial position, but we still fund services, not agencies. So.
Right. But my point is, we want more input. But I guess you're right. That would be on the finer points, not on the major categories. Okay, I'm done. Sorry.
Are we taking that caveat out about the agencies?
Approve the motion with the understanding that we'll send out better wording on the criminal justice. I think we have the idea here. We'll send it out to the group to do. And then, so Lori, you had a question?
I was just a little concerned about how do you decide which agencies to bring in and get input from without saying you're the ones we're going to be funding? Is that an unfair, and that's a process question, is that an unfair approach to this?
I think that's,
Talking community groups instead.
I think that's something we need to discuss on the 6th, because I agree. I think we have, and that's what I started out saying. We have a historical relationships with organizations, and we need to figure out how this communication takes place. So
I would propose we think about the people that are the groups that are represented by BHCC, because that group was kind of developed to say who are all of the players that are important in the behavioral health world. So maybe all of those people at the table, plus regional office of ed. Well, does Mark come to those? Regional office of ed, and yeah, think about that, Susan. I mean, that makes sense to me because we're wanting to get BHCC to be, you know, a partner in all this too. And that, see if that's comprehensive enough.
We're getting into process now again, though.
I think what we've kind of got our focus areas today. And then on the 6th, some of those, I think we can have some of those discussions about how and we're going to have to come up with some dollars. We can't avoid it. And, you know, see where we go in terms of how we present this to the public. When we say use services, what do we mean? So.
Yep.
Yes,
Are
sir.
we doing all those in favor?
Yeah, yes, please. I think we were at that point. Okay, motion passes with the understanding that we will send out a more word crafted version than what we have agreed to in principle here. So,
And because I like to beat dead horses, and you know that about me, sorry, I'm sure I'm annoying today. It does make sense to me to think about BHCC, because how did you all decide how those people should be chosen? And I mean, if you felt that was a broad representation of everyone, then that makes sense to me. If the county board thought that was a broad representation, then it would make sense to me that that would be who we might tap into to get input. Just a thought, because why would somebody have been left out of that group? You know, how did you all decide who all got to come to that table?
well, and I think at this point, we've spent time. I don't know if anybody has any additional comments. I'd certainly entertain a motion to adjourn if we're at that point. What is the July 6th? Do you want to send out a doodle poll again, Amy? To see, does this time work for people? I was trying to avoid an evening just to.
Yeah, thank you. I have, our
We have
normal,
a meeting.
I think is at 11 a.m. Does the Board of Health members, does 11 a.m. still meet for you guys, or still work for you guys on that first Monday? Okay. So I will, and I don't think, I will double check with Jessica, but I don't think we have to do we're doing the go-to meeting anymore. I think with the phase 4, it's in person up to 50 people. And so I think that we would be able to meet at the health department, but that did have some concerns as far as high-risk populations due to age, if it could be an accommodate.
Well, look,
Thanks, Amy.
So we could,
I don't have to worry about that.
so, you know, it's all
I
growing
know
up.
that doesn't affect this group, but I'll look into that for you guys.
I mean, if I don't know if the remote rules will apply, so just let us know, and obviously.
Okay.
All right, so but 11 a.m. sounds like we can confirm that. And then as far as in-person or go-to, I will get back to you guys on that.
We need to have a quorum physically present, so.
Yeah, you wanted me to reach out to Jessica Woods because of some of the changes in the Open Meeting Act because of COVID, and so.
I assume the county will have some policy in general for how these meetings are going, so we'll just wait to hear from that. Yes, Ms. Tello?
Just something for all of us to think about. I think we also have to be thinking about how does all this how does everything we're thinking about dovetail with the disparities, the racial disparities, because I do think social determinants in this are so embedded, and we didn't really talk about that today. And I think we're going to have to start bringing that into every conversation we have at the health department, including this. So, yeah. So I think we need to think about how are we weaving that through everything, and are there services to groups that we, are there unique services that we haven't even touched that we should be touching?
Yeah, and then Susan, is the CAFR released now?
Yes, ma'am.
Okay, because I looked for it a few weeks ago and it wasn't out on the website anyway, but.
I hope that it's out there. I know I got an email with it, so I do know that it is out there.
Okay, great. Because I think one of the things we may want to start doing on the 6th as well is have the CAFR. Susan, you can bring in your both hats to this and to start talking about money. As Judy mentioned, we have good arguments for how valuable and important this is. So,
And I'd suggest that the social disparities, which I mean, determinants, something that I mentioned earlier, it plays through all this. But I think, Corey, it's good that we know it does, that we make that part of the conversation so that, again, we as the health department have accepted that responsibility and people are aware of it.
Can I ask a question? I was a little confused. The Chestnut survey, did I get the sense that that is not happening now because they didn't get enough participation, so it's completely off the table now?
I don't think they've said whether or not it's completely off the table. It's off the table for now, but I don't know if that's a complete, I don't think it's been stated whether or not it's completely off the table.
Okay, well, I have a call into Joan Hartman, so I will find out. And when I find out, I will let you know. And I also will find out what Mark Jontry, what his thoughts are. Is that okay with everybody if I have those two conversations and without any, I mean, no guarantees of anything, just me information seeking? Is that okay? And then I'll get back to you.
sure. Yeah, go ahead, Susan.
On the one with the Chestnut, I think you might want to talk to Trisha because I know Trisha has worked with them and I know Trisha's on vacation this week. So
Okay.
in case Joan doesn't call you back, I think Trisha might have better knowledge of what's going on with that.
Thank you. Okay.
What we may have, as you said, there are various things that have gone on, and with our meeting with the Mental Health Advisory Board, we didn't get a full recommendation from that group. I think by the time we were done, I don't know if Corey, the group's going to meet again before our July meeting, this committee's July meeting. I mean, I think that those things will help us flesh out a little bit more how we want to put these RFPs out there with these more general categories.
Well, and they need to know, I mean, I believe 6 people voted altogether and then 2 abstained, or I think that was maybe the way it went. So, but now with Lori and Mary weighing in today, so we now have, quite a number of them having had input and making a decision. So, but I do have to figure out whether it's a meeting or something, because with the Mental Health Advisory Board, we have now kind of, they saw the categories that we started with today, and that's what they were weighing in on. And so we need to let them know that, we factored their input in, but we've now collapsed them. And so we owe them the dignity of, sharing what we've done with the information since they gave us some. And so I will maybe, for one thing, send out a memo to them or whatever. But then
Just a reminder, the MHAB is scheduled to meet July 17th, I think.
okay.
So we're scheduled to meet in the middle of this board's July and August meeting. So they'll be able to kind of bounce off
Right, okay.
and give
Yeah, that's
feedback.
probably soon enough, but I will send them something right away, because I would not want the board meeting to happen. And that's the first time they heard that we changed the categories. Does that make sense?
And
Yeah.
really
Appreciate
haven't
if you-
changed. Yeah, right.
Just kind of- So I see it's a little, about 10
Yeah,
after 5.
I just wanted to, based on
Go ahead, Mary. Yeah.
Corey's comment, I just wanted to throw in that category that we're trying to come up with a title for is probably one of the areas in our community and across the country where you see the widest disparity in treatment of individuals of color or economic disparities. So I want to make sure that we give that its own standing in the conversation, because that's where the disparities are most. I mean, if any of you have ever sat in a McLean County courtroom, it's appallingly apparent that racial disparities are a part of that system. And so I don't know, I was playing with court-related or court-involved supportive services, maybe would be some category along that line. Because that would be before and after, because they've been through the court system. So it would cover what Hannah was talking about and our problem-solving court, something like that.
Yeah.
But the supportive services, I think, is what I'm hearing from everybody.
Yeah, no, that sounds good. And if you want to send some ideas through, Mary, just please forward them and I'll be happy to look at them. And then I'll get back to the group with what I think that captures it. And, the problem-solving courts do a great job, but it's a limited group of people that they can work with. So, and not everybody in the courts falls within those program areas, but still need some follow-up and help when they leave. So,
I think I've shared with all of you except maybe Mary, but I'm sure Mary knows about it. You do know that I believe it's June 28th. They're having the Not in Our Town is going to offer that community event of looking at the movie Camden, and then they're going to have a facilitated community discussion about, what should change in terms of.
I mean, Carla sent us an email about that, didn't you, Carla, about health department sponsoring it? So I
I'm
think,
just saying, I think that'll give us some good information if we listen into what the public has to say about that night. I'm hoping I'm hoping some good ideas will come up from that discussion.
okay, so I think we got a lot to chew on before the 6th. So I have a motion to adjourn.
So moved.
So,
All right. Thanks, everybody. And we will see each other either in person, maybe, or not on the 6th.
And thanks
Thank
for
you.
putting up with me.
Oh, you are a driven woman. So, we appreciate it. All right.